Hi, everyone. My name is Pam Niese, and I am your state lead ambassador for Ohio. I am here to talk to you about an individual speaking constituent meeting with their lawmaker. You will never be alone. So, this is just one person speaking, but there may be other people in the room. We'll be using the hook, line, and sinker. The hook is who you are, what your name is, where you live, any relevant information that you would like to give. The line is why you're passionate about the issues. For instance, are you a survivor? Are you a thriver who's undergoing treatment right now? Or are you a caregiver? Or are you just someone very passionate about cancer and patients and their families? So, the hook is the introduction to your lawmaker. You're introducing yourself, you're giving them information, and the line is your passion. Why you're here, why you're talking to them about the policies that we need them to support. And the sinker is the ask. Will they support what we're asking of them? And since we're their constituents, we really, really need them to be on our side. So let's get started. I'm going to meet with my lawmaker, Roy Kloffenstein. He is in District 82, and he is in the House of Representatives. So I'm going to walk in, and I'm going to thank him for meeting with me to discuss these issues that I'm going to speak to him about. Thank you, Representative Kloffenstein, for meeting with me on today, Cancer Action Day, to talk to you and hopefully get your support for 4 bills. And we'll go ahead and go over them right now. My name is Pam Niese. I live in Glandorf, Ohio. I am a lifelong Putnam County person, and I'm very passionate about cancer. My sister, at the age of 40, died of cervical cancer. Not only that, but she got diagnosed when she was pregnant. So her treatment was very limited 20 years ago. Recently, my mother, who was 74, died of esophageal junction cancer, and that is a cancer that is sneaky. Patients with this type of cancer don't have many or any symptoms. Hers was caught after getting a chest x-ray for pneumonia, for which she had about a month before. Doctor wanted to make sure her pneumonia was gone. Something didn't look right on the chest x-ray. They wanted to take a deeper look. So they did a CAT scan of her chest. Off to the right side, they noticed that she had growths and spots in her liver. So we had more testing done, and she had an EGD and a colonoscopy. EJ junction cancer can stem from the colon, or it can stem from the stomach. They did an EGD and found that it was the stomach EJ junction that the cancer was there. And it metastasized to the liver. So in June and July, she had all these testing done. And in August, she started her chemotherapy. By the end of September, she was losing so much weight and she did not get any better. And it was decided with her and our family that she be put on hospice. And she had died on October 14th of 2022. I have other family members and other friends that have battled with cancer anywhere from the age of 86 years old, as my father-in-law had bladder cancer, to a friend of ours who was a kid that had leukemia. So I am very passionate about cancer patients and their families and what needs to be done to help them go through life with this dreaded disease. The first um, ask that I would like to talk about is our biomarker testing, or House Bill 24. We are asking that you support House Bill 24 to expand appropriate coverage of biomarker testing for public and private insurance plans. What is biomarker testing? It is the analysis of patients' tissue, blood, and biospecimens for the presence of a biomarker, or a DNA, if you will, that can provide insight into diseases like cancer, arthritis, other autoimmune diseases, and other rare diseases. Since my mom did not have any symptoms, she could have potentially had a biomarker test that would have showed her biomarker as EJ junction cancer, and it could have probably been treated sooner before the liver mets. Um, and her treatment would have been sooner, and her outcome could have been a little bit better. Biomarker testing is not a screening tool and is different from genetic testing or direct to consumer tests like 23andMe. Biomarker testing helps connect patients to the right treatment at the right time, and it is essential component of precision medicine and targeted therapy. Avoiding therapy is unlikely to provide clinical benefits. For example, a patient 54 years old does not have biomarker testing, but they know that she has lung cancer. She could be put on 6 different lung cancer medications before they find the one that will help her condition. Does she really need to go through 6 different kinds of medications? That's awfully expensive, and it's very harmful to the patient's body. Biomarker testing can do away with that. So again, we're asking you, Congressman Klopfenstein, to support House Bill 24 to expand appropriate coverage of biomarker testing for public and private insurance plans. I do not have to go through my hook again because he already knows who I am. So I will go on to the next topic, which would be copay accumulators. Of course, you can always look at your papers if you get lost. You can do it even if you don't get lost. So, copay accumulators are the next agenda, Representative Klopfenstein. And we want you to support House Bill X, the copay accumulator bill. And what that is copay assistance programs come from drug companies. You get a little card that will give you a discount if you're using that particular drug. And that is very helpful for when we're talking about high priced drugs. And it's a good thing. What's not a good thing is the insurance companies do not apply that money towards a patient's copay um, at the time of the use of the drug card. Therefore, when the benefit from the drug manufacturer goes away or is exhausted, the patient still has a huge copay that they have to deal with. By having a copay accumulator bill pass, many insurance plans will then add that amount that the company is giving the patient to their copayment, and therefore the copayment will decrease. Copay assistance programs can give patients access to life-saving medicine that they may not otherwise be able to afford. 16 states have already passed similar legislations. This bill was passed unanimously by the Ohio State of Representatives in 2022, and we need it to pass again in 2023. Will you support House Bill X, the copay accumulator bill? Give a little silence if you ask any questions. If you can answer them truthfully and you have that information, go ahead and answer them. If you do not have the information and it's a different kind of question that maybe you can't answer for whatever reason, tell him. I will take this question down and I will pass it along and we will get back with you. The third issue is, or the third bill is investing $20 million per year in tobacco prevention and cessation programs. We're asking you to support the current provision in the budget bill to increase tobacco control funding to $20 million per year, which is an increase of $5.5 million per year. Smoking is the single largest contributing factor to cancer in the United States, increasing the risk of at least 12 cancers. Smoking is estimated that smoking is responsible for an estimated 33.8% of cancer deaths in Ohio. According to the projections developed by the Campaign for Tobacco-Free Kids, increasing tobacco control funding by $5.5 million annually would mean 1,300 fewer Ohio kids growing up to be adults who will smoke. It will reach more communities with fact-based resources and help many, many people who want to quit with good resources. So we're asking, please support the current provision in the budget bill to increase tobacco control funding to $20 million per year, which is an increase of $5.5 million per year. And finally, our ask is continue funding for Ohio Breast and Cervical Cancer Project, or the BCCP, at $1.1 million in FY fiscal year 24 and $1.2 million in fiscal year 25. What is the BCCP? This helps guide approximately 7,000 uninsured or underinsured Ohioans through the healthcare system, find providers and community resources, and offers no-cost breast and cervical cancer screenings and diagnostic testing. Why is this important? Because breast cancer is the leading cancer for women in Ohio. Early detection is key to increasing an individual's chance of surviving cancer. Unfortunately, being underinsured or uninsured can make it difficult to keep up with cancer screenings. Will you support continued funding for Breast and Cervical Cancer Project or the BCCP at 1.1 million in FY24 and 1.2 million in FY25? Again, if you need your papers, please use them. Write down your story. Look over the bills. It will be fine. You will not be alone.